Hi, my name is Shahid Shah. I'm a health IT strategist as well as an architect and engineer for a number of years, building electronic health record solutions. And I wanted to thank Hello Health for inviting me to talk about the major problem that we're seeing these days in independent healthcare practices, and that is the cost of uncompensated care. What we're all pretty well aware of is doctors are struggling to make ends meet. In fact, this was a major article from the Wall Street Journal from just a few months ago, and it says some pretty obvious things that we all are familiar with. Other articles from CNN Money, New York Times, and even bloggers like popular Kevin MD have articles talking about going bankrupt, more doctors giving up on private practices, doctors going broke. These are pretty common kinds of stories that we're seeing more and more now. And what's really surprising is that when you look at the kinds of net income that physicians are seeing these days, it's numbers that we're not really accustomed to seeing. We always think about doctors as being very well off, and of course once you get really well educated you can make a lot of money, but in reality it's really tough to be able to make the kind of money that doctors used to be able to make. And in fact we're seeing the kinds of revenues coming in obviously reduced because of lower reimbursement. The costs are going up. So these are real problems that independent healthcare practices are seeing, and we're looking at a time in which independent healthcare practices may be starting to go extinct if we don't do something about it. So what is the problem here? Ultimately, uncompensated care is a problem. When physicians are doing a lot of work and not getting paid for it, then the problem of uncompensated care comes up. It'd be just like a CPA or an attorney spending many, many hours on work but not being paid for it. They also would be struggling, and that's what we're seeing with doctors today, is that they're doing a lot of work for a lot of patients, especially more and more every year to help meet that gap of reimbursements that they're seeing. But over time, we're not seeing their incomes go up because the amount of work that they're doing for free keeps going up as well. So what is this free work that they're doing? What are they doing all day? If you think about the number of things that they're working on, the only thing that they get paid for is the visits over here. If you think about this, look at this number at 16,000 or so in this particular study on an active caseload of about 8,500 patients. Look at the rest of the numbers that dwarf that, though. The telephone calls, refills, email messages, anything that does not have to do with a direct in-person visit is not compensated. Said another way, you have about 13 and a half hours of uncompensated hours per week of a primary care and specialists. So this is not a problem just in primary care. Specialists have it as well as primary care. In fact, in some cases, primary care may be even higher in certain environments, or especially with certain regulatory requirements in certain states where more work is required than it is in other states. So if you look at the list of activities, it's pretty long and pretty scary, because these numbers are averages, which means many physicians are spending a lot more time than this doing basically free work. What is the value of this, though? I mean, it's a lot of free work, but it can actually add up to a lot of dollars. And if you think about the low end on the primary care, about $33,000 on average, high end for specialists, about $50,000. And this is money that they'll never see again. It's been lost every year, and then these numbers are generally going. So what do we do about this? Ultimately, this is a problem for independent healthcare practices. We want to save independent healthcare practices, so what do? Well, you can try to reduce uncompensated time, you can try to pay for uncompensated time, or you can find alternate sources of revenue. Now, if you try to reduce uncompensated time, that's great. It's going to mean more free time for the doc, but it's almost impossible. You can't really get rid of work. Work almost always increases, it doesn't decrease. So trying to find ways of paying for it and finding alternate sources of revenue is really our only option. So how would we do that? Well, I firmly believe that health IT can generate revenue. How, though? If you think about the really big areas of health IT, can vanilla certified EHRs do that? Probably not. I mean, even though MU incentive money brings in revenue, it's not new revenue. You've had to pay for your EHR before you get anything in. You've got places like practice management and revenue cycle management, which are helping get paid for existing bills, which is awesome and it's absolutely necessary, but really does not help grow top-line revenue. So really one of the only areas that are left is these new telemedicine systems that have connected health already fully managed and going forward by connecting patients and physicians directly, patients to patients, and doctors to doctors. Why is that? Why can we see additional revenue generation opportunities for systems like telemedicine? Well, if you look at what happens in any general clinical encounter, there are preclinical experiences, clinical experiences, and post-clinical. In these areas of the pre and post-clinicals, these areas are completely left untouched by most EHRs, and there's a lot of interaction going on with patients that they would be willing to pay for. For example, helping with research, connecting before they actually come into the office, connecting with physicians after they leave the office. So if you look at the clinical experience where most EHRs focus, there's really not any place to make money there, additional revenue, but there is plenty on the pre and post clinical experiences. Where is that money really? What are the revenue center opportunities? There's a lot of connections that we can make between patients to patients, which is what we call community-based revenue center opportunities, where social networks, discussion forums, interest groups, et cetera, can be created. Physicians can make money off of ads in those areas and various other techniques as well. That's just one idea. If you look at the patient-to-patient coaching, the clinician-to-clinician sharing, lots of opportunities for those areas where physicians can stay in touch with patients after they leave or before they come in through email, e-consults, and many other techniques. Referral partners, sharing chart comments, doing pathway tracking, and the increase of sharing of records is your opportunity. If we can't fix all of this, this is the way really clinicians are feeling. They're kind of like feeling like they're in a doctor jail, so to speak, and they have no way of getting out. They were hoping that the health IT systems are going to come in and make life for them easier, but really it's just, meaningful use and other things have only increased the amount of work that they have to do, now also for free, because they're not really getting paid for direct care for those. So what does the market need? Not just simply better technology. You can't just say, well, if we just improve our technology, we're going to be doing better. What we really need is an innovative, practical, portable business model that can help these practices increase their top-line revenue from existing patients, not have to go pile on a whole new set of patients in order to make a little bit more money, without increasing their risk, of course. And so when you look at the problem of uncompensated care and you're looking at what can be done, there are solutions in the marketplace today that are doing these kind of things, and one of the best examples of that, of course, is Hello Health, because they're focused on giving out a free EHR that can come in, not take on additional cost burdens before being implemented, and then working with practices to help them set up additional revenue centers and grow top-line revenue. It's a brilliant business model, and one that I think that other companies should end up using as a model going forward. I wanted to thank again Hello Health for inviting me to do this quick talk on uncompensated care. Please do contact us if you have any questions. Thank you.